And g'day, welcome one and all. My name is Kane Treble. I'm a GP based out of far north West Victoria, and we are here, of course, as we are each week before the RACGP exams, to do a little bit of exam preparation. Of course, if you are joining in tonight, then you may very well be in the middle of your CCE exams, and a massive good luck for the final weekend coming up. Of course, you are in the middle of the CCE exams. But as always, we start with a bit of teaching. So there's still a few things you can learn even now in these final hours, I know. And we have a couple of cases tonight if we do have people in the chat that want to jump in and try and do them. But as we do, let's start with a bit of teaching first. And of course, the biggest thing I want to ask you to do now, as you're probably doing already, let's be honest, is actually reflect on how you performed on the weekend. Don't beat yourself up for any mistakes. I want you to focus on the good and the bad, but reflect on the cases that you found the most challenging during that first weekend. In particular, try and work out, well, what part of that wasn't I as strong in? What part didn't I feel like I did my best performance? Was it data gathering, diagnosis, management? Which part did you actually have the struggle? And for that as well, if you haven't already, actually record yourself handling a mock case and review your communication style, timing, and confidence level. You still have days left before you have to do the next weekend, so get in there, practice, look at where you don't feel like you're as confident as you wanted to be, and try and really hone in on those little bits for this upcoming weekend. Now, have a look at the high yield topics as well. We know that there's always going to be certain things that you're almost guaranteed to actually get as cases for the weekend. And so if you didn't see some of those things, there's a decent chance that's what you're in for this coming weekend. So focus on those key topics that are common in the CCE, looking at acute and chronic care, mental health, pediatric conditions, elderly care. And then when you're looking at those things, ask yourself what one or two factors could be, tinkered with. What could be changed that would actually have a dramatic implication on management for that actual patient? Build up your adaptability, build up the things that might catch you up on the day. Have a think about these things beforehand. And of course, as we do in GP every single day, focus in on your decision-making skills with that element of uncertainty. So practice your risk assessments, practice your safety netting. So for those ambiguous cases, make sure you actually have a bit of a go-to plan of how you're going to manage diagnostic uncertainty and have that follow-up plan. So always, when am I going to see you next, and what are the red flags I want you to be looking out for that would result in you needing to escalate care between these times. And of course, this is a stressful time, so stress and self-care strategies, very important. I know we tell our patients to do it, we should be doing it ourselves. So mindfulness, stress management, manage your anxieties, try and stay calm under these very stressful times. Do breathing exercises, practice that mindfulness breaks, schedule them into your calendar so that you've actually got kind of fixed times to do them in. And try and maintain a little bit of work-life balance or study-life balance here. The fact that you're watching a live stream at 8:30 at night may not be helping that, I do apologise. But make sure you are getting enough breaks, you're eating well, you're getting some exercise, you're resting adequately, and keep up your energy and focus for this coming weekend. To the point as well, we're on the Friday, have a little bit of a day off, have a bit of a rest, recharge, make sure you're ready and focused for that weekend. Remember, as we said last week as well, each case is independent and one slip-up can be offset by a strong performance in other cases. You've prepared thoroughly. Again, the fact that you're watching these videos, watching this live stream is testament to that, and making one mistake or messing up one case doesn't define your overall capability. Remember that. Refocus on what you can control, like moving confidently into the next case. Now, speaking of cases, we may have a few practice cases here tonight. I can see we've got a few people in the chat there, so I'm going to pop a link in. If you would like, I've got 2 cases prepared, so if you would like to do a practice case, I encourage you to join in on Zoom, and we'll see what we can do to run through a couple of cases. Let me just try and bring up here. Pardon me. It's always great when you cough into an open microphone. It's a great move, Kane. Now, of course, if people don't jump in on Zoom or don't want to participate, that is fine as well. We can always have a crack at just talking through a case, so I'm more than happy to do that. I will have a little look here and just see if we've got anyone joining in yet. And so far, it is just ourselves. Again, as I said, that's perfectly fine. If you do want to do another practice case, click on that link, sign in on Zoom, and give it a go. Otherwise, we can talk through the case and just go from there for the first one. As I mentioned last week, these cases are going to be available on the Generally Practicing website, so that if you want to have a look, have a go at practicing these with other people, you'll have that opportunity there. Let me bring up that link on the screen as well. You'd think this would be a link I would have ready to go, but there you are. So that's the website there, generallypracticing.com. Up the top, you'll see exam preparation as a menu option. Click on that and it'll take you through to where you can download the cases. Now, of course, it wouldn't be one of our exam prep nights if we didn't have Kesh Minder here. So, Kesh, can you hear me okay? I'm probably muted.
Yes.
No, I'm muted.
Yes.
Beautiful.
Yes. I can hear you. Can you hear me?
I can hear you. Let me bring you up on the screen there. Fantastic.
Okay.
Excellent. And you can see the screen as well with the text on there?
I don't have control yet, but I can see
Yep.
the screen.
There we go. You should have control now. Excellent.
Yes.
So,
Yes.
with that, let's get 5 minutes on the clock. Your reading time starts now. And your reading time is up. Case time begins.
Hi, Liam. My name is Dr. Cash.
Hey,
How can I help you today?
my mum booked an appointment, so I'm here now.
Okay. So, Liam, are you all right having your mom here during the consultation, or because I can chat with you alone without the presence of your mom, or are you happy with her being
Mm,
around?
Whatever. I don't mind.
Okay. How about if I talk to you first and then later call your mom in? Is that all right with you? Yeah.
Yeah.
Okay, no worries. Now, Liam, I just want to let you know that whatever conversation that we're going to have today, it's going to be confidential between you and me. And it's only the matter that if anything arises where your safety is at harm or someone else, then I will have to break the confidentiality kind of thing. Right. So I was just looking through your notes. I believe you are having an exam coming very soon. Is
Yeah,
that
it
right?
sucks. You wouldn't get it.
Oh, I have been through quite a lot of exam actually, to be honest, Liam. And I can quite understand how you're feeling actually. Is this something the first time for you, or has it occurred before?
No, I've got exams like all the time at school.
Yeah.
Yeah.
So what's different between this exam versus the previous exams?
I guess just my parents are just always on me about it. Like I'm trying to do as good as I can, but it's like it's never good enough.
Yeah. Have your grades been coming down lately or something?
They're okay. They're pretty good, I guess.
Okay. Is there something troubling you at school or anything?
No, I just get really wound up about it.
Okay. Have you managed to see your teacher to talk to your teacher or get extra coaching or tuition or something like that?
They say I don't really need it because I'm doing
Yeah.
pretty good, I guess.
Okay. Right. And tell me a bit more about the chest tightness that you've been having actually.
Hmm. Yeah, that's just when I'm thinking about the exams or like
Yeah.
people are talking about them all the time or like we're trying to study. I just feel like it's just all tight in here and like I can't breathe and what
Yeah.
if I fail and then I won't go to uni and then I won't get a job and I'll be stuck living with my parents all the time. And it's just
Okay.
yeah.
All right. Liam, I can understand you're quite overwhelmed with all that is going on. I mean, with the exam and then plus you're having this chest tightness. I just want to reassure you that I'm here to help you out. And we're going to work something out. And I just need to ask you a bit more questions. It might sound a lot actually, and I'll be asking you a series of questions just to make sure it's not anything more than stress or anxiety or anything like that.
Mm.
Is there anything you're concerned about that chest tightness that you have?
I just want it to go away. It just sucks.
Okay. Yep. Yep. And how long does it last for?
I normally like have to go like leave and stop doing what I'm doing and it kind of goes away I guess kinda like 5-10 minutes.
Okay. Is there anything that can help for it to go quicker or anything like that?
It's like a tablet or something I can take.
Um, depending on what we find. Um, but I'm just saying that is there anything that you do can make it worse or make it better or anything like that that you know
Uh, when it happens when I'm around my friends and then I get all embarrassed and like
of? Okay.
then it I guess gets worse and like I worry about what they're gonna say about me and stuff. Um,
Okay.
yeah, and then
Right.
like at night I'm just sitting there just thinking about it and like what if I
Yep.
have this happen to me tomorrow kind of thing? What are they gonna think?
Okay.
Um, yeah.
Right. Um, have you experienced any pain in your arm or anything like that?
No,
Have you had any clots in your legs or
none
have
that
you
I know
been
about.
okay? Have you felt ill or felt like fainting when you're having that chest tightness or anything like that?
I guess sometimes like I breathe a bit quick and like then I
Yep.
feel a bit dizzy for a bit, but then it kind of like stops and like
Okay.
yeah.
Anyone in your family has heart disease that you know
Nah, they're all pretty good.
of? Okay. And now, if you don't mind, Liam, I'm just going to ask you a couple of other questions in relation to drugs and alcohol. Sounds like a really big thing, but I'm going to reassure you that this is just between us. And the reason why I ask you this, it might have something to do with some of the
Nah,
symptoms
but
and stuff
I
like
don't do any of that kind of stuff. I'm a
that. Okay.
bit more like nerdy and stuff, so I don't do any of that kind of thing.
Okay. What about smoking?
Nah, no.
Okay. So I believe you don't have any thoughts of harming yourself or harming others. Is that right?
No.
Yep. Okay. Okay, that's good. And how's your home situation? Is your parents supportive of you?
Yeah, but like I just wish they like wouldn't be as much because like they're always
Yeah.
like, you know, oh, can we help you? Can we help you? Can we help you do more
Yeah.
study?
Yeah.
You know, it's so important that you study.
Yeah.
And like, I just feel like then, like, what happens if I don't do good? Like, are they going to be upset? And
Hmm.
you know, I just sometimes I just wish they just kind of leave me alone.
Okay. Have they ever, have they ever physically hurt you or verbally or
Nah,
anything?
nothing like that.
Okay. Right.
Yeah.
And how's your relationship with your sister? Is she
Oh, she's so annoying.
she's so annoying? Sisters are annoying actually
Yeah,
at
she
times.
just bothers me, bugs me all the
Yeah.
time, and I'm just
Yeah.
like, leave me alone.
Okay. And do you have a room for you to do the study and all that?
Yeah, but I'm not allowed to lock my door anymore because I'm not
Yeah.
allowed to.
Why? Why is that?
Oh, I was on the internet and
Yeah.
yeah,
Okay. Um, Look, there's a bit more question now. When you are doing your studies, do you take any breaks in between your studies, exercises or
uh,
anything?
well, I used to play soccer, but I kind of stopped that a little while ago.
Okay.
I had to
Right.
study and you know just didn't really feel
Yeah.
like hanging out with people as much. So
Okay. And do you have a girlfriend or someone that you're seeing?
nah,
Okay.
I'm not really seeing anyone right now.
Okay. And have you engaged in any sexual activity? I know this is quite personal, but is that something? No, not at
No.
all. What about in the past or anything? No? Okay, I do. How's your sleep?
Uh, yeah, it hasn't been good lately. Like I just keep sitting there like staring at the ceiling and like
Hmm.
saying, well, what if I don't study? What if I don't do good? You know, don't
Do
get
you know
into uni.
how many hours do you sleep at night or anything?
Um, I like go to bed at like 10 or 11.
Yep.
I go to sleep at like midnight or 1.
Yep.
Then mum wakes me up for school at like 7.
Okay. So usually, ideally, we would like people to have like 8 hours of sleep at night, because that helps to recharge your thoughts and give your brain a bit of a rest. Uh, Now, have you been losing any weight recently or anything like that? Any
No,
cough or anything?
no,
Any change in your bowel habits or urinary habits or anything?
no.
Okay, right. Now, what I think likely you might be having is um, it could be anxiety from coming because of the exam, and that can present in many ways that you can have, sometimes you can feel your heart is racing. You can have a bit of chest tightness, sweating, feeling very
Oh yeah, I got so
nervous.
sweaty. Yeah.
Yep, yep, yep. So I think there are few things I would propose that we should do for you. which you can do. The first thing what I call is general measures, where I believe you should have some exercise, at least, 30 minutes, 5 times a day, every day. Especially you do need to take breaks between your exam. And the exercise, what it does is it helps to release endorphins inside your body. And that endorphins is those feeling good hormones kind of thing, make you feel charged, make you feel relaxed, and makes you feel a bit more geared up for the exam. How's that sound?
Yeah. I'm like,
Right? And then I'll give you a handout to teach you some mindfulness techniques that you can do, because and also relaxation therapy, such as just walking in the park, or going for a swim. That can help you to keep you
think you get like
relaxed.
apps for that or something.
Yes, they have apps. Hit mind I can't remember the website actually, but I can Google for you. There are apps. Actually, one of it, there is also Beyond Blue, Black Dog Institute, and they have that sort of stuff. The other thing we were talking about is sleep, that you need at least 8 hours of sleep, and then during the daytime, especially between your study period, like after an hour or so, you should take at least 10 minutes break, just do a bit of walking or something like that, just to get your mind off. um, and then the other thing, the next step is seeing a psychologist. Do you know who are they?
Yeah, I think I saw one like a couple of years back.
Yeah.
But then like school and stuff happened and we didn't go back. So yeah,
Okay.
I guess they helped a bit. Yeah.
So in your school, you have counselors that you can
Yeah.
see too, so as well.
Yeah, that's where
That's
I
one.
saw them. Yeah.
Okay, right. So psychologist is someone. So for someone like you can have 10 visit a year to see a psychologist. And some psychologists, they are performance coach. They can teach you things to deal with your anxiety for your exam. So that might be helpful actually for you. They can teach you some techniques on how to focus more on your exam, because what your body and your mind is doing is it is taking you out of focus on your exam. So that's why you have all this anxiety, and that's why you're so heightened up that you're not able to concentrate on your studies. And it can be um, quite stressful, and you might lose focus entirely for your exam. Um, of course, nobody wants to fail. Nobody wants to fail. Everybody wants to do well. Everybody wants to go to university. But there's so much we can do on our side to reach there. But with these strategies, I believe we can try to make some sort of improvement for you, Liam. What do you think?
Yeah, I guess that could help. Give it a shot.
Yeah. The other thing, when you were speaking of tablets, now there are some tablets that we can use just for short term, just to reduce anxiety. But the other thing is, if we do use the tablet, sometimes it might be detrimental for you also as well. Like it might help you, the symptom, you might become too dopey and too sleepy, and you're not able to focus on
It's
the
me
exam.
anyway.
Um, I feel we don't need to go to that direction if possible. So
Yeah.
usually I would like to see you again to do a full mental health consult, where I'll check your mental health status, see how anxious you are. And then I think the first step is actually seeing a psychologist first and see whether that helps or not. And then we can start. And look, your mom doesn't need to know. Nobody needs to know. None of your friends need to know also as well. And
I mean, I'm
saying
pretty sure
that,
my mum knows already, and I don't care if she knows, but yeah.
okay. If you are happy, I can even talk to her, and with your permission, I would like to talk to your mom also, to just get a bit more history on, and see what she has to say and stuff.
Yeah, that's all right.
And I believe your parents definitely would love to help you out also as well. Unfortunately, they can't sit the exam for you though.
Yeah, they mean well. They're just so embarrassing.
Yeah. Uh, yeah, I guess. But look, you are year 10. It's going to be a very big year for you. And, after that, it's university years. It's going to be more exams again. And
Yeah.
have you thought what you want to do or anything like that?
Well, I was thinking of becoming a doctor actually.
Oh, like
Yeah.
me. All
Well,
right.
I've heard good things.
Okay.
And that's
Well,
time. Oh, that was exhausting.
yes, it was. You're a good role player. It's not like the role player
Oh,
in the
it's
exam.
yeah, I've got kids and I deal with a lot of teenagers as well. And
Yeah.
in fact, we've got in from the chat here from Demir Kane, your mate more expressive than the actors I got on Sunday, lol, poker faces, and
Yes.
10 out of 10
Yes.
moody teenager. So,
Yeah. I tell you, the role player for the exam is just horrible, actually. It's not really like a role
mm,
player at all.
yeah,
I feel some of them are talking really slow, and some of them, I do not know, they just take their own time. Like, either we are
yeah.
feeling time is running too quick for us or what.
It can be a bit hit and miss. And trying to get role players across all cases, across all sites as well. And you will find as well, particularly towards the end of the day, um,
Yeah.
that they're so tired that they're just sick of it. They're over it. They're sick of role playing.
Yeah.
So, particularly from the afternoons on the Sunday, yeah, you're getting a lot of poker faces and slow responses, unfortunately.
But I was just wondering how, okay, let's say
Mm.
if the role player is talking, going a bit out, maybe telling you some things that you think might not be so important.
Mhm.
Could you like how do you be nice to them to just cut them off or something, or do we just have to just listen to it and
Yep. So, and
unfortunately?
this is exactly like real life as well. Is that you're trying to ask about their chest pain, and the patient's sitting there saying, "Oh yes, and I was driving was a '74 Chevy actually," and you're like, "Okay, tell me about your
Yeah.
chest pain. You're sweaty and diaphoretic. I want to know about the chest pain." It's just that sometimes cutting in and saying, "Look, that's really important. I'm glad you've mentioned that, but I'm just actually wondering, could you just double back on and do it in a nice way so that you're more
Yeah.
redirecting the patient." Um, if they're building up towards something important, they'll softly insist that they continue. But it is that kind of dynamic of working with patients and trying to tease out the bits we need to find out. If you feel like you are running out of time, similar to what you did at the start of this case, actually, which I thought was good, was a couple of broader questions, and then oh look, just a couple of rapid questions, just kind of yes no responses, and just boom 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 boom. You can get through a kind of heads assessment in this case, or rapid fire kind of. I just need to know yes or no to this. You can knock off a lot of things that way. Um, which actually coming back to this case then, so I think you did a fantastic heads assessment. You did jump around the order a little bit, but I think it
Yes.
was done in
Yes.
such a way that it was actually following what I was saying, and I think that shows experience in actually taking a history and being able to follow the patient along their thing while keeping in mind the checkpoints you're wanting to kind of get through. So I think that was good.
I was just trying to build rapport because
Yeah.
you're dealing with a 15-year-old boy,
Yep.
and
I've had practice,
it is quite challenging actually. So
Yeah, and
I do not know whether the first part where I mentioned taking the history from the patient itself without having the mother, whether that's all
no,
right or
that
not
was
to do.
fantastic, and that was actually one of the points I had on here as well. Was looking into Gaelic competency and
Yeah.
do you speak to the patient? Do you speak to the mother? And I think as long as you acknowledge that, oh, hey, I'd like to speak to you as well as speak to your mother at some point. And I think you came back to that at the end of saying, hey, at some point I'd like to speak to your mum. You got the consent there as well, which is very
Yeah.
important. So I think that was fine. And again, these kinds of teenage cases, particularly coming into these kind of 15, 16, 17 kind of thing, you want to give them that little bit more autonomy and say, look, I'd like to speak to you alone if you're happy with that. And some kids are very happy to, I shouldn't say kids, sorry, it sounds rather dismissive, but some young people are very happy to just talk in front of their parents and have no reservations about that. But some will actually kind of say, oh, whatever, yeah, okay. And that's usually oh, hey, mum or dad, mind just ducking out for a minute. So, and I think you did that well, so that was fine. So you got all of the heads questionnaire components done perfectly. Probably the one thing I would actually add was when it comes to suicide and self-harm, you very, very appropriately kind of said, oh, hey, have you had any thoughts of hurting yourself? I think it's really important to actually go that next step and really spell out, often when people are having a hard time with their mental health, they do get thoughts around things like suicide. Is that something you've been thinking about? You do have to really say that because,
Yeah.
you get that kind of, oh, no, no, no kind of thing. But unless you specifically ask about suicide, that's a big checkbox that doesn't get ticked. I think, though, in this case, you more than made up for it with pretty much every other aspect. I really liked as well that you kind of asked about sexual health and sexuality, sexual activity in a way that was very non-confrontational, and you picked up that, okay, he wasn't too happy to talk about it, but you still kind of confirmed that as well and asked another question, even though the kid was obviously a little bit uncomfortable. So
Because
well
I
done
didn't
there.
know whether I should ask about whether
Yep, yeah,
what
definitely.
do you identify as or something.
Well, you can
I
actually throw that in there. That wasn't actually built into this case, but these days in particular, it is actually really helpful to kind of say, hey, do you have any kind of sexual orientation, sexual preference? Do you have
okay.
anything about your identity that you would want me to know? And I usually throw that in kind of at the start of a consult. Particularly, you'll always find you attract certain kind of cohorts of patients, and I have a collection of gender diverse patients, and so building that
Okay.
rapport very quickly, and it's a good way to flag as well that, hey, I'm aware of this. This is on my radar. This is something I think about. So yeah, very helpful. For the RACGP exams, they're a little bit old school. I don't think that's going to be on their curriculum or radar just yet. But for day-to-day
I'm
practice,
thinking
throw
it
that in
might
there.
come actually
You
because
never
it's
know.
been
You never know.
I'm actually I'm thinking of that actually. So
Yep.
you know.
Now, yep. So I liked that you safety netted. You put in to say, look, here's our plan. This is what we're going to do. You tick the boxes in terms of mentioning medication, although acknowledging that not appropriate this time. But because the patient had raised it several times, you kind of said, look, that is an option. We would use it for some things, but I don't think you're there yet. I really like that you said, I'll bring you back and we'll actually do an assessment and get some measurements there. These kinds of cases, you don't normally have enough time to kind of do a K10 or DAS21 or anything like that. But I think, and that's why this one spelled out, use the HEADS framework. You linked in for mindfulness. You linked in for online programs with a little bit of prompting. That's okay.
Yes.
And the
Forgot about it.
psychologist referral, definitely. Have you heard of the BRAVE program?
No.
No, I've popped the link into the chat there. It's braveu. I can't read that; it's way too small. If you
Okay.
if you follow through the link there, or just
Yep.
Google Brave
Yep.
program, it is a mental health program run through, I believe it's University of Queensland, which actually
Okay.
has a child and adolescent kind of separate programs looking at mental health, including things like depression, stress, and anxiety. Absolutely brilliant, free of charge as well. And what I like the most about it is there's a program for the child and a program for the parents.
Oh.
Because for these cases, the parents need just as much education as the kids do as well. So, really, really useful for that. If you haven't seen it or used it before, have a look. Absolutely awesome. Look, clear pass for the case.
I think the other
Did
thing
well.
is I forgot to mention again, like what you mentioned to us the last is the safety netting actually, and I didn't mention that if things get worse, I need you to be back this day at a time.
Yep, that's okay. You still put in and said, hey, we're going to be catching up again, and you'd
Yeah,
done the
I was.
risk assessment as well in terms of, have you
Yeah.
thought about self harm kind of thing. So you put it on the radar. It is good to kind of spell out, hey, if you get thoughts like that or you feel like things are getting on top of you, come back in sooner. It's as simple as you need to be. Excellent. So, we'll probably finish up this case then. If you're, I know you can't say anything about the actual cases themselves, but so far, how are you feeling about last weekend?
I think I did a bit better than the first time, but still, I think one of the question I got the diagnosis right, but I totally forgot the whole pathology, like how to explain to the parent what is that condition all about.
Yep.
And I just do not know. I just lost it there. I told a few things, but I could have done better. Like I would have told about the
Yep.
school
That's okay. You can't
situation.
say
Like
you. I have to be very careful what you do and don't say on this. Yeah.
Yeah.
Cool. Here's the
So
thing. You've picked that up now. Use that and flag for yourself as well. Make sure you don't do that for this weekend's cases. But it does come back to going back and reading that instructions for the candidate. What is your specific task? And it might be then your thing is make sure you write that at the top of the page so that you are constantly seeing that and reflect back onto that. But yeah,
I think I should have mentioned that I will print a handout about this condition and also give it to the parent. I should have
Yep.
mentioned that, but I didn't. So
That's okay. Pick that up and
I
use that for all the other cases then this weekend.
so I'm hoping that this next one on this Saturday, I just have to do it even better than the last week one.
Yep. That was just one case.
Yep.
Hang in there, mate. Again, if you're doing like you're doing today, you're fine. You're going to do just fine, mate.
Thank you so much, Kian. Thank you so
No
much.
worries.
All right.
All right.
Yep.
So, if we jump back over then for the prepared feedback for this case, if that's going to work. No, it's not. Good one, Kane. There we go. So for this case, the competent candidate demonstrates appropriate use of the HEADS framework to gather a comprehensive psychological history, identifies the parts of it that actually need acting on, safety netting, and teasing out what are their actual risk factors. Really important here was the communication aspect. So building rapport with the patient, getting them to the point where they're actually able to communicate and talk to you. And of course, using those evidence-based interventions such as CBT, mindfulness, stress management techniques to actually put in an appropriate management plan, which was one of the key tasks for this case, and organising that follow-up. So again, this is something that we will not infrequently see in general practice and is a perfect kind of fair game case for the actual exams as well. We do have one more case prepared here tonight, so if someone else wants to jump in, feel free. Whoop, I do apologise. Let's get that off the screen there. We will copy the invite link. I'm going to pop this into the chat there. And if anyone wants to have a crack at the second case, please click that link, follow it through, and we have one more case prepared to challenge your CCE skills and, of course, give you feedback in a safe manner. If no one does jump through, that's fine as well, and we can just talk through the case that is there. But again, you've got a few days left before the second weekend of this 2024.2 CCE exam series, and so I'd encourage you to take the opportunity. And, of course, we have Demir. How are you going, mate? Good to see you again. It wouldn't be a live stream without you.
Oh.
Happy to give this next case a crack. Can you see the screen?
Yeah.
And I'll just give you access. You should have access now. Can you just confirm you can scroll up and down? Perfect. Let's put 5 minutes on the clock for your reading time, and your reading time starts now. Your reading time is over. Your case time begins.
Hi, sir. I'm Dr. Demir.
Hi, Demir.
What can I do for you today?
I think I might be pregnant.
Oh, all right. Okay. Wow. How do you feel?
Sick.
Right. Look, it's can be quite an overwhelming situation to find yourself in, hey? Tell me in general, how are you feeling about finding yourself pregnant? What's on your mind?
I don't know. I mean, I only just found out myself and I just don't know what to do.
Okay. Well, have you been pregnant before?
No, it's the first time.
Okay. And have you told anyone yet?
No, I just made the appointment here.
When did you find out?
2 days ago. I didn't know if it was right, so I did a couple of them, but they're all saying positive.
Yeah. Okay. All right. How do you feel about the pregnancy? Do you have any thoughts of what you want to do?
Honestly, don't know. I mean, I didn't expect this to happen, and don't know if I'm ready to be a mum. You know, do I feel strange about not keeping it?
Okay. You haven't told the father, I take it?
No.
No. Okay. Do you know who it is, though?
Yeah, but like it was a one night stand kind of thing, so yeah.
Okay. All right. So look, Sarah, I'll tell you straight away that everything we discuss here is confidential. Okay. It's all between us, and I'll talk you through sort of what our options are going forward, what sort of things we need to do, and then we'll make a plan for the next few weeks. Okay.
Thank you.
All right. So you're a retail manager, is that right?
Yeah, I've been doing it for like 2 years now almost.
Okay. And you don't smoke, but you drink occasionally, is that right?
Yeah, like if I go out and stuff, you know, have a couple of drinks.
Okay. Do you know much about drinking in pregnancy?
I know you're not supposed to.
Yeah. Just something I should mention to you straight away, since you're not telling me that you want to go for any kind of termination. At least at this point, I do have to tell you about a few things to keep the pregnancy healthy, and one of them is to let you know no amount of drinking is safe. Do you use any recreational drugs at all?
No, nothing like that.
Okay, all right. And in terms of your diet, would you say you have fruits, vegetables, meat, dairy, all in your diet?
Yeah, I eat pretty much everything.
Okay. Are you taking any vitamins or supplements at the moment?
No, should I be?
Yeah, so to keep a pregnancy healthy, it's important to take a pregnancy supplement. It's something called Elevate. If you just go to the chemist and take one a day, very good thing to do. Okay.
Right.
Any medical trouble with you up to this point?
No, I'm normally pretty fit and healthy.
Mental health wise, any trouble?
Normally good. Bit stressed now.
Understand. Yeah. Listen, the reason I asked the next question is because many women find themselves in an uncomfortable situation, and it's something that can be hard to talk about. But any violence, abuse?
No, nothing like that. No.
you're pretty happy that you're safe. Nobody's coercing you into doing anything.
No. I don't know how I'm supposed to tell the father though.
Look, it's your choice in the end. Okay, it's your body. It can be helpful to have that discussion together. I understand that the two of you are not a couple, right? That one's kind of in your hands. Well, we might get back to that, but there are ways to let them know and sort of involve them, in a positive way.
Yeah.
Probably your parents would be, I don't know what your relationship was like, but I think you might find them quite supportive in dealing with this
Yeah, they're
situation.
usually pretty good with stuff. I think this might freak them out a little bit, but
I assure you it's nothing. Most adults have gone through this before. It can be quite helpful. Okay. Have you ever had a sexually transmitted disease?
I haven't usually had too much sex, to be honest. No.
Okay, fair enough. So when was your last menstrual period?
I think like 5 or 6 weeks ago.
Yeah, okay. And since then, any discharge, bleeding, spotting?
No. I think my boobs are a bit sore though.
Okay, that can happen. Are you getting any nausea?
Like little bits just first thing in the morning. It's not too bad though. Normally by the time I kind of get up and start doing stuff, it's okay again.
Right, okay. Any pain in your tummy or down there?
No.
Okay. As part of the sort of first things to do when you become pregnant, there's some blood tests, some scans that we run. One of the things we do is a sexually transmitted disease check. And what that involves is a blood test and a swab down there, okay? If you may have something without knowing it. So if you have something like chlamydia or syphilis, it's something that can affect the baby or the pregnancy.
I think I've got anything. I don't have any symptoms.
No, it's unlikely, but it's a part of our due diligence to check. Okay, all right. So that's something we'll do at the end as well. I'll give you some forms and send you to get those tests done. Any dizziness, lightheadedness? Okay. So part of the workup here is to send you for a scan. Okay. So we'll do a blood test that confirms that you're pregnant, but we'll need to do a scan to make sure the pregnancy is in the right place. So in the uterus, rarely pregnancy can happen not in the uterus where it's supposed to, but in the tubes that connect the uterus to the ovaries that make the eggs. If you've got a pregnancy in the wrong place, A, that pregnancy cannot go to term, and B, that pregnancy can make you very ill or can make you die when it bursts or ruptures. It's called an ectopic pregnancy.
I've heard of that.
Yeah, so we have to make sure that you've got a pregnancy in the uterus. If you don't, we'll need to that pregnancy will need to be terminated. Okay.
Right.
So that's just part of our regular, is that we send you for a scan. Now that scan is done through the vagina. Okay, just to let you know, not through the belly, but through the vagina. Are you on any hormonal contraceptive at the moment?
I was on the pill a couple of years back, but I wasn't really very active then, so I guess I just kind of stopped taking it.
Okay, understood. We'll need to check, part of the blood test is to check your immunizations. I would check them online right now for you, but unfortunately I'm not able to.
They're all up to date.
Oh, okay, all right. I do need to let you know not to work with potting mix. to make sure you wash all your fruits and vegetables so you don't get certain diseases that can harm not you but your pregnancy if you contract them. Look, I think as far as making sure the pregnancy is healthy and tracking it, we've talked about all the things I wanted to talk to you about. I personally don't have much to do with pregnancies. As a doctor, I usually send people to one of my excellent colleagues, GP obstetricians,
Yep.
and that's what we'll do. I'll book you in with one of them to discuss the results and again rediscuss where you want to go with the pregnancy. Did you want me to talk you through about options for termination? If
Yeah,
that's the way you
I
wanna
guess
go?
just so I know what the options are, I guess.
Yeah, okay. So as far as termination, there's two different ways to do it. There's medical and there's surgical. Okay. For medical termination, it's a tablet, again, unfortunately not something that I prescribe myself, but it's something you can take up to 9 weeks of pregnancy. Okay. It's a tablet that you take, and within the next 2 weeks, that tablet terminates the pregnancy, and you pass the products of conception out of the uterus, out of your vagina. Okay. There are risks of pain, bleeding, infection with that one, risk of incomplete termination or the tablet failing to work, in which case we'll need to proceed to surgical termination. If you go with the tablet, you'll need to have a blood test follow-up in 4 weeks and see one of our doctors in 4 weeks after you take the tablet to make sure that the pregnancy is terminated.
Yep. What's the surgical one then?
So the surgical one is where a bit self-explanatory. The surgeon would put you to sleep. They would use instruments to get inside the uterus and terminate the pregnancy. Make sure all the products of conception are out. That way, you know for sure that it's done. But there may be costs associated with that for having the procedure or for travel, and you'll have to take a few days off work. Okay. I would strongly encourage you to bring a support person with you next time.
Yeah, good idea. I'll bring my mum.
Whichever,
Always there.
yeah, mom's a great idea.
What
Whichever
about-
way you go.
What about if I don't want to get an abortion, but I'm not ready to be a mum?
Yes, of course. The third option is adoption, so you can carry a pregnancy to term, and then you can the baby is then taken care of by an adoption agency. Pass it on to a family who are not able to but want to have kids. Okay, thank you for reminding me of that one. Do you have any other questions?
So you said I'll have a follow up with whenever people in your clinic. When should I be seeing them? Or how soon can I kind of find all this out?
No problem. I'll talk you through that. Just give me a second. One other thing to mention is try not to take the ibuprofen for your headaches in the meantime. Try to stick with paracetamol instead.
Yeah.
Ibuprofen rarely, but can be a bit harmful to a pregnancy.
Okay.
So going forward, what we'll do is I'll give you forms. That's a form for your scan. This is a form for your blood tests. This is a form for the swab. And I'll show you how to do that swab. There'll be a handout that'll talk you through it, or the pathology people will talk you through it. What we'll do is we'll follow up. We'll book you an appointment with one of our GP obstetricians in a week's time. By that time, the results will be available, and you can talk through your options with them and bring your mum with you. I do need to let you know about a few safety things. So, if something happens with the pregnancy, let's say it's an ectopic pregnancy, there's a few things you need to look out for. If you're getting a sudden onset of pain in your tummy, bleeding, fever, dizziness, make sure you go to the emergency department or get an ambulance.
Yeah.
if an ectopic pregnancy ruptures, it can be required.
Okay.
You'll need to act quickly.
And that is time. Well done. So, how do you feel you went? I think you did pretty good. I think you're looking like you don't feel like you're as comfortable with that one as I've seen you with other cases. You said that personally you don't deal much with pregnancies. Sounds like you've got other GP obs in the practice that do most of that for you. Yeah.
5 of them, yes.
5. Wow. Lucky. And that's fine as well. I think you actually did quite well in the case still. So really, this one is about the communication styles and giving those all the options on the table, and you very much accomplished that. Having a management plan in terms of actually, first of all, confirming, is she actually pregnant? And that's kind of usually step one. And you did that. You had that appropriate follow-up plan in there to say, okay, well, let's find out, one, are you pregnant? We'll do the blood test, we'll do the scan, and then we'll bring you back and we'll talk through from there. Next part of it then is saying, well, okay, here's what all your options are. And I think you did quite well of, you can keep the baby, you can terminate the baby, you can foster the baby. A little bit of prompting, that's okay. And that is one of those things as well that often for those ones like that people do forget, there can be a prompt in the script for the sim patient to actually kind of ask that question as well. And while we're not giving you the answer, it's, hey, do you even have this response on your radar? And you did. That's fine. I think something you did fantastic on was actually explore, what are your support networks and mentioning, I think next time you come in, bring your support person, because this is going to be an emotional roller coaster. And that's actually one of the big boxes that needed to be checked for this case as well. And I also thought you did a really good job of navigating kind of, one night stand. How do you actually tell the partner about that as well? And I really liked, I can't remember the exact wording you used, but it was, look, let's just kind of navigate this first step first and we can come back to that bit later. I actually thought that was a really nice, really gentle approach to it, that for a patient that's come in obviously kind of anxious and worried, I think you did really, really well there. The red flags you were getting through at the end, but just ran out of time. But the big one is, ectopic, and I think you did enough to kind of flag that there. The other thing you can also kind of throw into that category is spontaneous miscarriage, which, up to a third of all pregnancies can spontaneous miscarriage in that first trimester. I think you also did a good job of kind of quickly saying, hey, if you are pregnant and you're undecided, let's just set everything up so that baby's safe and you can make decisions down the line. And that was quite well done. We do have a message in from the chat from Kashminder about genetic carrier screening and CST. I would probably flag CST in this consult. I'd probably leave the genetic carrier screening and those kinds of things for subsequent consults personally. And a part of that would probably be just timing. I think that would be something you would probably do once you actually have established whether or not baby's going to be sticking around, if this is going to be a pregnancy to term, if that makes sense. But again, things to have on the radar. So I think while it was evident it wasn't the most comfortable case for you, I think you still ticked enough boxes there to have gotten through, and in particular your communication skills, I think would have made you a very much a pass on that case. So well done, mate.
Great.
Is good now to know this because pregnancies can come up for the CCE, and so I'd probably just refresh your memory, do a little bit of reading up over the next couple of days just on first trimester management. But again, if you got this on the day, you'd be fine. Well done.
Cheers.
I'll leave you to it then, and perfect. Let's go through then our competency things. One day I'll get these screens right, but it is not this day. There we go. In this case, the competent candidate demonstrates an understanding of pregnancy options and their respective processes. has an appropriate and sensitive prompt to tease out the history, in particular those social circumstances around this, and putting in a supportive management plan tailored to those specific patient needs. Communication, really important to be empathetic, non-judgmental, make this a safe place to let Sarah actually open up about the more sensitive aspects of that pregnancy. And as I think was done wonderfully here, in a neutral, non-directive manner, emphasizing that patient autonomy and again, using our evidence-based resources. So pregnancy is a little bit of a trap for a lot of GPs, especially if it is something where you have lots of other people in your practice that may kind of pick up that caseload. Things like pregnancy and mental health, very common for this. It's all fair game on the exam. And so it is something that if you know this is a weak area for you or an area where you want to be stronger on the day, I'd encourage you to use these last few days to have a read through. And probably one final thing I would tack on to the end of this case here was it's a perfect opportunity, as was done here, STI screening, but also talk about contraception in the future as well. We've had one little accident here. How about we get a bit of a plan in place to make sure we don't have any accidents in the future? Those were the cases I had prepared. I didn't want to leave tonight being too long or too late. I appreciate sleep is quite important to you all at the moment. And so I'm happy to hang around in the chat for a little bit. If you do have any other questions, anything you want to ask, or any comments you would like to make, feel free to throw it in the chat now, and I'll try and get to it. Otherwise, we'll kind of wrap it up. Again, a massive congratulations for just surviving the last weekend in the first instance. I know it's a time where not everyone necessarily feels as confident as they would like to. Everyone comes out of the exams feeling that, so don't let that dissuade you from how you're going to do this weekend. The fact that you're here watching this shows you're putting in effort, you're doing all the right things. Practice, practice, practice. Get that little bit more exposure and time in before this weekend. Rest up, get into this weekend and smash those cases. If I can do it, you can do it. You're going to be fine. Now, no questions or comments coming through on the chat. So with that, we might wrap it up here then for tonight. If this is the last stream or video you see from me, a massive pat on the back and congratulations for getting through. All the best for the exams. And yeah, I don't know. You can probably unsubscribe now. I probably shouldn't say that, but no. All the best to you guys. And feel free to let me know in the chat or comments later on how you went, how you feel. And of course, I'd love to hear from those that have gotten through to celebrate with you as well. So thank you very much, Kane, from the chat there. And of course, you are more than welcome. So my name's Kane Treble. It is 9:37 at night. Let's go to bed. That's not a great segue after the last case. That's I'll work on that one. See you guys.